Good afternoon, and thank you for joining us for our Washington Medical Commission Lunch and Learn. My name is Micah Matthews. I'm the Deputy Executive Director for the Medical Commission. I am pleased to introduce to you this afternoon Pat Devine, Director of Community Outreach and HEALWA at the University of Washington, and Commissioner Jim Anderson, PAC, of the Washington Medical Commission. They together will be giving an overview of the HEALWA resource, demonstrating specifically the DynaMed resource within it, and its benefits to WMC commissioners and licensees. For those unfamiliar, the HEALWA resource is a dedicated resource for the majority of Washington licensed healthcare practitioners to access evidence-based practice support materials. The policy goal of the legislature was to streamline access to such information, provide a common benefit to licensees, and improve Washington patient care through greater access to evidence-based resources. The legislature made a policy decision in 2008 that a dedicated educational resource should be made available to licensed healthcare practitioners in Washington. The HEALWA resources is tied directly to your license, and each MD and PA pays a $32 surcharge on each renewal to fund the resource. There are many journals and resources to assist practice available at no additional cost, and CMEs may be earned in the use of those resources. To sum up, the legislature has clearly said and emphasized over a 14-year period that the use of HEALWA is the state policy for our licensees. Since its creation by the legislature, the resource has had more funding added, with more professions requesting and receiving access almost annually. With that, I will turn it over to Pat and Commissioner Anderson.
Thank you. I am, as Micah said, I'm Pat Devine, and I'm a medical librarian responsible for the day-to-day operation of the HEALWA website. And just one more point of history: the project was started by a former director of the University of Washington Health Sciences Library, and Dr. Peter Dunbar, who was president of the Washington State Medical Association at that time. And they got together to create this plan for providers who don't have access to resources that they need. If you're not associated with a large hospital system or with a university, then you don't have access to all the resources that those people do have access to. So the HEALWA is meant to help fill that gap. And we currently have 27 professions, with veterinarians being the latest to be added. So the HEALWA collection is a robust collection of journals and databases and point-of-care tools. And the HEALWA page provides a search box which searches many sources at once and is a good starting point. Many of our users are looking for journal articles, guidelines, and other clinical practice information. This is all of the things that you can access on HEALWA. And if I will demonstrate the website in a minute, but if you are looking for something that you can't find, I'm also available to help you. And here is my contact information. So now we'll go to the live site. Well, I tried to stop sharing, but it didn't. Can you still see the slide, Micah?
I don't see the slide anymore.
Okay.
But it is now back.
I want to get to the HEALWA site, and I'm not sure how to do it with this interface.
You may need to choose what you are sharing. There should be a little sharing like application within the GoToMeeting.
I see that, but it's not changing anything. Just a second, I'll try something else.
Well, she logged herself out.
Sorry, I got kicked off, but now I'm back.
So I made you a presenter again.
And we can see your screen and your web browser, so you're good.
Okay. Not sure what went wrong. I had this all set up before. Can you see HEALWA now?
Yes, and I would recommend maximizing your browser window.
Okay. So to use HEALWA, you just go to healwa.org and log in once you've created a account. Okay. Is the print size okay on the screen now? Can you see it?
I can see it fine. If you asked us to read the social media, it might be a little tough.
Okay. Looks bigger in real life. So if you don't have an account yet on HEALWA, one of these rotating slides on the front page is getting started. So you can click on that, or you can go to help and click on getting started. Since HEALWA is run by the University of Washington under a contract with the DOH, it's called a UW-Net ID when you get a HEALWA ID, but it's a little confusing because it's not the same as accessing the University of Washington library, but it is an impressive and robust collection. It's just not the same as the University of Washington library. So to get started, you need your license number and the email address that the DOH has on file for you. And then you log in, you sign up for an account. So once you've logged in, then instead of seeing login right here, you'll see welcome to HEALWA, and then you know that you're logged in. So the search box at the top of the page does search the entire website, journal articles and guidelines and ebooks and databases, but you can also go directly to the resource that you want to use. And in this case, we're going to show DynaMed. So at one of the links at the top is the popular resources, and DynaMed is right here. So once you are in DynaMed, you can create your own little free account within the database in order to earn CEs and sign up for alerts and keep track of what you're doing. And you can also sign up to get updates on topics of interest to you. So similar to UpToDate, DynaMed is a clinical support tool which assures that providers are using evidence-based medicine to make decisions. DynaMed and UpToDate are competitors, and some users prefer one interface over the other, but the clinical information found in both of the tools is comparable. There was a recent randomized controlled trial published in January 2022 that states that both tools are similar. DynaMed is updated daily, and it has a rigorous editorial process which systematically monitors content in thousands of journals, which are indexed in PubMed, and hundreds of clinical practice guidelines. There's currently over 100,000 evidence and guideline summaries within DynaMed from 3,500 journals and guideline organizations from around the world. There's a team of practicing physicians who identify and appraise and summarize the clinical trials and the clinical practice guidelines. DynaMed employs 125 physicians, and specialists work with systematic review teams to survey the current literature for relevance to clinical practice guidelines. All the new content is reviewed by an editorial team, which is trained in evidence-based medicine, and new topics are added to meet information needs of clinicians and provide support in clinical decision-making. The home screen, which we're on now, includes recent alerts and evidence updates, as you can see here. And there's a link for potentially practice-changing information. So this, what we're looking at right now is all of the recent alerts. But if you click on potentially practice-changing, then you can see changes in drug use and treatment procedures, or things that have been found to not work. So we'll go back to all. So let's try a couple of searches here to show you how this works. I'll search atrial fibrillation in the search box at the top of the page. So this gives you an overview page with information on evaluation and management of the condition. So by looking here, for example, you could see what a clinician should do when this condition is suspected and how the condition should be managed, like right here, for example, management. And when a journal article is quoted in these guidelines, then it's linked so that you can go right to the article from here and learn more about the condition. Also, evaluation talks about what factors should be considered to diagnose the condition. And management here also. There are overviews, and then there are more detailed steps to treating the condition. Then related topics at the bottom, like tells you more on atrial fibrillation screening and the steps to be followed to determine that condition. You can also search drugs here and learn all you need to know about them. Warfarin, for instance. Then that gives you a calculator and more information about the drug and dosing information. Another thing you might want to look at is drug interactions. So here on the top toolbar, you can enter 2 drugs. And this gives you a warning that there's a major problem with these, prescribing these 2 together. Let's try another search where you would be searching for the appropriate treatment. So ankle fracture. This tells you how to diagnose and treat this condition and what to watch for. It includes emergency management, and as with all the topics, there are possibilities to click for future information, for further information, sorry, not future. That's all I have to show you right now. We have lots of time for questions. And Jim, did you have anything else to add about how you use DynaMed? Is he unmuted, Micah?
I don't see him on the call.
Okay. Maybe he had trouble getting on. Does anyone else have any questions or anything that you would like me to search?
We do have a hand raised and a question in the questions box, but what I would like to say is that I am going to unmute everyone. So feel free to speak as you would like.
Do you want to read me the question?
Yes, it is, would non-practitioner public member commissioners qualify for an account?
Well, HEALWA is funded by the license fees of the participating professions. So generally, no. It would possibly be something we could talk about. Would the public members be working with a clinician on a case and maybe get access that way, or would they be doing their own research?
This is John Malden. Can you hear me?
Yeah.
Okay. So I had the same question. I'm a public member and I look up stuff all the time, and I don't work with physicians when I'm looking at cases. So I have the same question, whether or not it would be open to public members or is there some way to cheat the system?
It's possible that we can have a conversation with DOH and the commission about that for the future. So I will follow up with that.
Thank you.
You're welcome. And someone had their hand raised.
Did someone else want to say something, or?
Go ahead, Dr. Curry.
Okay, hi. This is Diana Curry. I'm one of the commissioner clinical. Quick question. There's a lot of articles that I find myself looking for that are in fairly obscure journals, which I'm guessing may not be part of the usual database. How onerous is it to request specific journal articles, or does someone have to pay for it? Do we pay for it? Like, what's the process, other than I got your email, which, by the way, I love the fact that your email is divine@uw.
Oh.
I'm sure everybody tells you that, but yeah, that's my question.
You can request articles on the front page you can just write to me, but also on the front page of HEALWA, it's one of the slides is request articles. And so you just click there and it gives you my address to email me. It usually only takes a day or two.
Is it a pretty onerous process for you, though? Like if we requested 6 articles, or what's the kind of,
Well, it's only me, so it's best to be selective, but it's also possible that it's on HEALWA. Sometimes there's a lot of different ways to find things, so sometimes it may not be showing up, but you can request what you need and we'll go from there.
Okay, so just in terms of experience, I've occasionally, I had access to the UW database through the UW NetID previously, and there were quite a few journals that they used to have to get me articles for, and they'd go to whatever other institutional databases. So is HEALWA using the same databases as UW uses, or is there an overlap there, or?
There's some overlap in our collections, but we do have some things they don't have too. Another thing about access for clinicians in Washington State is if you serve as a preceptor or a lecturer for the medical school, then you could be appointed clinical faculty and have access to the library that way.
Right,
So,
that's what I used to have. And I'm
okay.
assuming through that net ID, I would do a different net ID as a commissioner. Is that right?
Actually, you link it when you sign up for HEALWA. If you have an existing net ID, you link it to include HEALWA. So it tells you how to do that in the instructions for signing up.
Any other questions? Pat, you had mentioned some thoughts you wanted to share, I believe, on how HEALWA could be used not only for commissioners in doing their work, but also possibly for respondents who maybe have to do research on a compliance piece, such as a paper or something else. Did you have something specific you wanted to show on that?
Yeah, you could search I haven't tried this search, so I don't know what's going to happen, but you could search just ethics in general on the HEALWA page. And here's a list of resources. You can also search ethics in DynaMed. Most of the ethics entries in DynaMed are related to end-of-life care. But this is like, here's one, pediatric bioethics. So you could also search, refine your search to pediatric bioethics and get, see if you got more targeted items. But this will give you access to articles or books. You can also search in PubMed and then look for the articles on HEALWA or request them if we don't have them. Is there another topic they might be writing a paper on other than ethics, Ncqa?
For this, I will crowdsource it. I'm sure there's some commissioners who have past practitioners who they've assigned a paper to on specific subjects. Anybody have a suggestion?
A lot of it is like boundary issues, professionalism, HIPAA related concerns or privacy concerns. I don't know if we have like, you know, the Journal of Medical Regulation like we get through FSMB or other journals related to sort of the regulatory side of medicine.
Yeah, well, we would look around a little bit. Let's see. Journal of what?
Medical Regulation, JMR. It's the professional journal, I guess, of medical regulators.
You can also, for HEALWA, if you want to know if we subscribe to a particular journal, you can also go to databases and e-journals list. Looks like we do not have that one. But they could definitely search just using the main search box for their topic, and you know the respondents are licensed professionals who also have access to HEALWA, and I can help them too if they don't find something that they need.
Sure. I guess this would be a good place to ask if there was a particular journal that someone wanted to have added or have access to, how would that occur?
We can look into it. Most of the journals come through packages, so it's not always easy to add another one. Sometimes it's easier just to get the articles from the journal, but we definitely take suggestions and can look into adding resources.
Okay. I'm also noticing that Commissioner Anderson has joined us, and I think you mentioned he had some comments that he wanted to share as well.
Still muted, Jim.
He may be having some technical issues still. So we'll continue to take questions if anybody has them.
We do have one question in the question box. Dr. Yu asked if DynaMed has drug warnings from the FDA.
Like some things that just came out, it should be in the recent alerts. Is that what you mean?
I'm looking at a device drug alert from May 25th right down there. So I think the answer is yes.
You can hear Jim now.
Yeah, I'm unmuted now if I can be of any assistance.
Did you have an example you wanted to give about how you use DynaMed or HEALWA?
Yeah, for sure. I mean, I would go back a little bit and say that when I was in my first job out of PA school, I worked in an inpatient setting, and you know, there was a common discordance between residents and everybody about DynaMed versus versus up to date. But I used DynaMed all the time, and I still do in my practice. You know, I work now in addiction medicine, and so it's a more narrow scope. But I find DynaMed to be really easy to utilize, particularly once people get to know how to use it. So, you know, I can find things. I can you know, particularly like I don't really do primary care in my work, but I work mostly with people who have addiction to opiate use disorder. But when they talk to me about their maladies, and I try and figure out how to direct them, I find DynaMed to be very helpful as far as trying to understand better about what their diagnoses are and how I can best direct them. So I find it very helpful.
So
And I guess this is a question for both of y'all. Could you walk us through a little bit more about the CME aspect with DynaMed? I know that other resources act as kind of a ticker, so to speak. And so I was curious if you could demonstrate what that looks like for folks.
Yeah, I just signed in to DynaMed, and so you just create a free account and sign in there, and just from using it, you get CE credits. So right here it says I have 3.5 available. I don't want to claim them because I'm afraid I'll be accused of fraud, but just by using the tool, you earn CME credits, and then when you sign up for an account before you start, and then it keeps track of your credits.
It used to be a lot more difficult, but it's become a lot easier, and that's. I mean, I think the value of DynaMed for the commission and for the RCMs is to try and learn more information about the cases that we're charged with reviewing, and at the same time, there's also CME available for all of our searches on DynaMed.
So, Dr. Curtis, did you have a question?
I was just curious. Jim says that there are, how do you get used to using, any hints about getting used to? I'm used to using UpToDate, but I have lost access to that since I retired. So I may need to be going to DynaMed more. Is it pretty much the same as searching things on UpToDate, or any hints?
Yeah, that's a great question, and I would say, yeah, I think it's pretty intuitive. I mean, for example, I think Pat showed a few things as far as, name the malady, but for example, Pat, could you type in opioid use disorder? And it's, and then maybe click on that top one, Pat. And there it is, on the left-hand side, it's all really neatly organized as far as, epidemiology, diagnosis, et cetera. And so let's say, for example, we wanted to know how to diagnose this thing. Pat, could you click on diagnosis? And if you wheel down a little bit, you see a diagnostic criteria. I mean, it's really nicely organized. And I don't think it's that different from UpToDate. It's, on the left-hand side, you've got the where to click, and the right-hand side, you've got the information. So it's it takes a little bit of maneuvering to get used to navigating it. If somebody was used to using UpToDate and now they can't, but I think it's pretty intuitive, and it's become more and more intuitive over the years too.
And I'll just point out for anybody paying attention that the CME counter, once this search was done, went at the top middle from 3.5 to 4.0. So it is actively counting those CMEs. So that's something to be watchful for, and just be aware of that. Again,
yeah,
you get that benefit that you can apply to your every 4-year renewal as well.
And when I look at this, for example, I mean, opioid use disorder, I mean, it's a little bit esoteric. I mean, compared to diabetes and COPD, et cetera. But when I review this, which I look at it frequently. I mean, it's very much up to date. It's very much the most recent data is integrated into this, and I like that about it. It's very helpful for me in my work.
I may have forgotten to mention that it's updated daily. This database is updated daily.
So does it tell you when a particular topic was last updated?
I don't see that on here. Let's go down to the bottom.
I know on UpToDate, it's at the top under the banner, but if it tells me someplace, because that's important to me too.
For sure. So Pat, as you wheel down, I mean, if you click on something, I mean, it gives you, for example, okay, now it's talking about Canadian guidelines, and it gives you, it gives you all the dates and the PDF. So I think they go out of their way to be sure and date whatever you're looking at, which is really helpful.
This is also a good feature, this Medline Search in the middle here. You can just automatically search Medline from right here, and then you could see the latest that way. But It looks like it does not have a updated date.
Well, I think if you click on something though, Pat, like for example, maybe you click on quality improvement to the left and maybe about 2/3 down. And so
It has recent journal articles cited
yeah,
there.
sure. 2015 to 21. I mean, you can see the dates of what they're giving you. So whoever asked this question, I missed that, but I think that's really crucial, right? Was it like 2004 or was it later?
Yeah.
So that's important, particularly if you're in Australia. Just kidding, but that's what it says. It's choosing wisely in Australia. Also,
You got muted again, Jim.
Okay.
also the references, like for example, on the bottom left, you click on references. Oops. They're all nicely dated. And most of them are pretty recent.
So we have a question in the questions box that says, does this include the NCQA guideline clearinghouse articles?
Does DynaMed include that?
Correct.
Drum roll.
What is NCQA?
Scott, can you not unmute yourself?
I believe it's the
Maybe.
National Council on Quality Assurance. They do.
I'm sorry, it's AHRQ. I think that it moved.
Oh.
I was just curious whether it includes those resources. It would really have research relevance, compares a lot of other countries, not just, it has NHS and NICE, which are always the really good outcomes research. It's available online. I was just wondering if it integrates it.
That's a good question.
I'm not positive about that. I would assume so because they are getting guidelines from all over, and AHRQ is like the main agency for guidelines, so I think so.
But I think the bottom line of this is that if you have a license, then you've already paid for this, and here it is. So I think it's a nice tool. I've used it many times as far as my RCM work. Whether you're a medical provider or whether you're a public member, I think it's a great way to see what's up with the cases that we're presented with.
Yeah, I would love to have access to that. I typically look up guidelines and try to find things that are not on pay sites, or if I'm taking a class at the university, I'll sometimes use the library there to look up some of the guidelines articles. It would be nice to have essentially the up to date, but health watch.
So Pat, you're the expert as far as what licenses are able to access this, and attorneys are not in that category.
Right. We're going to have a conversation about that later.
Yeah, particularly about attorneys who are involved, or attorneys or non-attorneys who are public members who are involved on the medical commission. I mean, they need to be able to know what the hell is going on with these things too.
Yeah, well, as you know, the access is determined by the legislature, and the resources are paid for by the license fees, but there may be a possible solution.
Yeah, sure.
So this is Claire. You know, the RCMs who are non-physicians are working with physicians all the time and impacting physicians' work. So although they're not buying those licenses, they're certainly engaged in that data. And it makes sense to give them access.
We'll have a conversation with Pat to figure out, because one of the things that I noticed Pat saying was that it's tied to an email that's on file with the department. And since you all have WMC state official emails, that might be part of the trigger that will allow us to get access. So it'll be an ongoing point of conversation, and we'll see what we can do about it.
This is John Malden. I regularly use Medline Plus, so it's reassuring that, to me, the information I'm getting there is something that is linked to DynaMed. So it makes me feel better about what I'm reading and learning from.
Oh yeah, Medline Plus is a definitely an authoritative site. You know, National Library of Medicine, and everything is peer reviewed and kept up to date. That's definitely a good site to use.
I've been using it for a number of years. It's always been very helpful to me.
I will say, John, that's always where I sent patients for information. Don't Google it, go there first.
I always go to Medline Plus for anything I do on the commission. And it's, for me, it gets me most of what I need to know. So I'm just glad to hear that it's a good resource.
Yeah, definitely.
And I'm really heartened to hear that too, because I've always, you know, I'm sometimes really depressed by the sources that some of my colleagues use. You know, I looked it up on, you know, whatever, this some weird Google thing, and I think it's Medline. It's really nice to have at least a few go-to places that you know are vetted and evidence-based. So that's great. It's nice to hear.
Okay.
Well, anytime that I want to know that if I have Ebola, I always use WebMD. So
Use Medline Plus instead.
Yeah, don't use WebMD.
All right.
So do you have any other questions, any comments, we can even say any requests for specific searches to see how it would go in HEALWA or DynaMed from attendees?
So we do have one more question in the questions box from Yan Ling. It says, does DynaMed include Beers criteria for potentially inappropriate medication use?
What is Beers criteria?
That's why I said it that way, because I'm
It's
not sure.
medications that are generally not recommended for people over 65 or something like that. It might be a point of care tool if it's got a category of point of care tools.
Actually, I just did a quick search, and it looks like that Beers criteria is indeed included.
Right here.
Beers and start inappropriate criteria are included in DynaMed database. When I think of beers, I think of something else.
Yeah.
But,
That'd be lager or ale criteria.
It's from the German Medical Board.
So it looks like the information is included in the entry for the drug.
I just searched for Beers criteria and I got characteristics of New England to India Pale Ale produced using Norwegian yeast. So I think that the answer to Yanling is you have to look on the specific drug as opposed to just search the category of Beers criteria in general.
so what would be a drug that might be?
Can you see my screen with warfarin, the warfarin search result?
Yeah, so individual drugs or classes of drugs will have Beers criteria associated with them. I was just wondering if, like, for Yanling, if you could just search, like, generally tell me all the drugs that, you know, have warnings. So it doesn't look like you can do that. But yeah, many drugs, all the, you know, morphine related, all the diazepam type things, estrogens. I mean, there's all kinds of things where it's not recommended over a certain age and you have to be careful or redose according to age, that type of thing.
Pat, could I ask you a question real quick? Can you click on the calculators? Maybe it's already been discussed, but I'd like to see what that said. I mean, this is a very rich base of calculators.
Yeah, there's quite a few of them.
Yeah, and that's a really helpful tool as well. Thanks.
I'm curious about the decision tree calculator over to the left. Okay.
That's pretty cool.
I don't know, I kind of like the anthrax one.
Yeah, I want to see that one.
Something that you need in your daily practice.
I like some of these are very simple, like yes or no. I like that. Pat, can you see what it says for strep? It's like strep throat.
In the decision tree or just any calculator?
In the decision tree.
It doesn't have a decision tree for strep.
It's got SARS though.
Yeah, these are my kind of trees. Yes, no.
Okay, let's end with the image of HEALWA so you can all go there and sign up for an account.
Because you already paid for it.
Right.
All right. Any final thoughts, final questions? All right, hearing none.
Thank you.
Okay, thanks.
So
And you know
much.
where to reach me.
Thanks, Pat.
Thank you so much.
And
You're
thank you
welcome.
for joining us today on our webinar. And we'll see you next in July.